Dr. Smith.
Very good. Good evening, everybody. That was truly very interesting, and I'm a big fan of lycopene. Also in that watermelon. But this evening, my task is to talk about stage 4 prostate cancer and castration-resistant prostate cancer. I want to thank our sponsors and thank all of you here in attendance. So, what is castration-resistant prostate cancer? It is a form of advanced prostate cancer. It is a cancer that is no longer completely responding to treatments that lower testosterone. It shows a cancer sign of growth with a rising PSA and even with low levels of testosterone. With metastatic castration-resistant prostate cancer, the cancer stops responding to hormone treatment and is found in other parts of the body, and it spreads to lymph nodes, bone, the bladder, rectum, liver, lungs, and even the brain. Stage 4 prostate cancer does not mean a less than hopeful outcome. Clinicians offer palliative care, which is special.
The slide.
You want me to share?
Yes.
Okay, I'll do it now for you. All right. There you go. I'll go to the next one. Jerry, it did not move, unfortunately. Let me go back. Let me stop sharing. See if I can pull it together again.
Well, if it's not, you can just go ahead. Move.
There we go. Okay. All right. Let me just go back to what I was saying. Clinicians offer palliative care, which is specialized medical care that focuses on relief from pain and other symptoms of serious illness. However, hospice care is different in that it's the end-of-life care for a patient with terminal illness and not expected to survive more than 6 months or less. The treatment of stage 4 has progressed to the point where men with stage 4 are living 10 years or longer with innovative care. This is why FEN promotes active enrollment in clinical trials as treatment results continue to amaze. So under our FEN path, we go to metastatic castration-resistant, and our first slide shows us the treatment pathways. We have one group where we have no treatment. These patients have had no prior chemotherapy, docetaxel, and they've had no hormonal therapy. In group 2, these patients have had prior chemotherapy, such as docetaxel, and no novel hormonal therapy. Group 3, however, is novel hormone therapy, and they've had a novel therapy, but no chemotherapy. And the last group have had both treatments, prior docetaxel and novel hormone therapy. And let me just state, all of the time, they all have continued their treatment with ADT. So the treatment options in group 1, as you see from the slide here, again, no prior chemotherapy and no prior treatment with our hormone therapies such as darolutamide, apalutamide, and enzalutamide. But again, always ADT is present as a foundation. So preferred treatments are the abiraterone, the docetaxel, but the other that you see on the slide are very useful, and your clinician will discuss with you these options so that you and your clinician can make a treatment decision that's in your best interest. That second group now is a little different. Again, they've had prior docetaxel or chemotherapy, but no novel hormone therapy. And so, again, ADT is continuing, but the preferred treatment here is the abiraterone and the enzalutamide. But the useful meds and treatments under these circumstances are just a little different, as you can see here, but very similar for many. And we also recommend such things such as corticosteroids, the ketoconazole, and at times anti-androgen withdrawal. Our third treatment option, again, people with prior novel hormone therapy, such as the albuterol and the darolutamide, but no docetaxel. These individuals do benefit from adding the docetaxel. And in the last group, we have the benefit from the other additional add-ons that have been effective for many individuals. And you can see those 6 or 7 that we there. Other recommended therapies will include adding albuterol plus dexamethasone, enzalutamide, and other first-generation anti-androgen treatment options. So we see good outcomes, and we move to the fourth group. This fourth group, they've had both. They've had the chemotherapy, they've had the novel hormone therapy, and we find that the preferred regimen here is a little different chemotherapy, a docetaxel re-challenge, and now we're moving on to some different meds like the olaparib, the cabazitaxel, the radium-222, and the additional recommended, such as the enzalutamide, the first generation, the corticosteroids, and the anti-androgen withdrawal. So in summary here, you should go to our website. Each of these different group options have a video, and each of these videos are a case presentation put together by Dr. Crawford, and they tell you the story of each individual a man as he has taken these different treatment options and have brought them into their clinical world. And again, we're finding these men living much longer, and we know that we've seen men 10 years. We've had a speaker here in the past that was 16 years and in survivorship. So please, it is important to continue with our review on our website. The website's important, and we can't again stress the importance of clinical trials as you make a decision to treatment options when you have stage 4, both metastatic or non-metastatic castration-resistant cancer. Any questions?
Thank you, Dr. Smith. What we're going to do is this. There's one thing, just to clarify, if you wanted to give them some key takeaways, we had 4 different, this is metastatic castration-resistant prostate cancer. It was 4 groups. And basically it boils down to whether or not you've had chemotherapy or you've had more advanced hormone therapy. And one thing that Dr. Smith was talking about that was extremely important, this was metastatic castration-resistant disease. And this is castration-resistant words, not the first line or your ADTs. And we'll be talking about more of that in detail in the future, that they're not working anymore. But these are people that have advanced metastatic disease, a state in which people thought there was no other option. So there are options. We're going to go into this in more detail. But remember, if you have any questions that you'd like to ask, you can always either call us or you can email us, and we'll be able to answer those questions in detail. But what I wanted to do, it was very important. What we talked about, we gave you scientific proof. You know, a key opinion leader that talks about your diet profile, because that's what we're walking away with. But at the end of managing survivorship, we want you to hear from prostate cancer survivors. We want you to hear about someone who's implementing this type of dietary pattern into their life. So first, I'd like to play a video. And then we're going to have an opportunity to speak with Mr. Hill. And he's going to be able to answer questions because he's been doing this plant-based, flexitarian diet for years, close to a decade or over a decade.